continuing on, we're going to discuss the REMS, which is the Risk Evaluation and Mitigation Strategy. So the FDA Amendments Act of 2007 gave the FDA the authority to require a REMS from manufacturers to ensure that the benefits of certain drugs and biologics outweigh the risks. If the FDA feels that the drug has serious concerns that would not be sufficiently addressed with the use of a box warning and medication guides, they can mandate the use of a REMS. This ensures that the risks are known and are managed adequately. The manufacturer, also known as the drug sponsor, develops the REMS and gets FDA approval before implementation. It can be required for a new drug or drug class, or when safety issues arise with an existing drug. There are 4 parts to a REMS. So the first part is the communication plan. The second component is the element to assure safe use. Third component is the implementation systems. And then, of course, the fourth component are med guides. So let's do an example. So everyone remembers studying thalidomide. And the problem with thalidomide was that if a pregnant woman ingests it, it can cause severe birth defects. So the thalidomide REMS program, which used to be called the STEPS program, that was enacted. And what it mandated was that there has to be a negative pregnancy test before the medication would be dispensed. The next system that everyone is pretty familiar with are all the hoops you have to jump through if you are dispensing Accutane products. And these also can cause severe birth defects like thalidomide. So this REMS program is the iPledge program. This does not only require 1 pregnancy test to be able to dispense the medication, but it requires 2 negative pregnancy tests. This is before the first or initial fill, and then there has to be another negative pregnancy test prior to dispensing any of the refills. So usually each time the medication is dispensed, it's only given a 1-month supply so that the full parameters of the iPledge program and the severity of it, so that all conditions are met. If they are not met, there are big fines that get laid out. The next medication with an REMS program that we're pretty familiar with is clozapine. So the risk of being on clozapine for patients is that they can experience severe neutropenia. And so it's very important that labs are drawn before this medication is allowed to be dispensed. So the absolute neutrophil counts, the ANC, has to be monitored. Another medication that can cause severe birth defects is Qsymia. So Qsymia is something that is used for weight loss, but can have a lot of issues. So Qsymia is a combination medication that includes phentermine, which could also be given by itself, but it is combined with topiramate. So that is the reason why there could be such issues with taking this if you're pregnant. So there's the Qsymia REMS program. Of course, the med guide has to be dispensed. It's required. There has to be a training program of all of the healthcare staff, and it's dispensed only through pharmacies that are certified to dispense the product. We're just going to discuss two more medications and the risks and the components of their REMS. So with like opiates, we know that opiates carry risks, obviously. So they have high abuse potential. They can cause severe and life-threatening respiratory depression, and then, which looks very, very serious, to patients that are maybe taking a benzodiazepine or other things that are also CNS depressants. Like opiates already carry this risk, so many patients that are on opiates usually also take something that can compound this respiratory depression concern. So this REMS program is where providers have to educate patients about completing this program and satisfying the requirements. So providers as well as the patients have to be educated about opiate treatment choices. They also have to be educated about monitoring pain, because if you can reduce dosing, and really try to taper off the medication, that would be the best case scenario. So we have to dispense the medication guides, which are required. The med guide requirements are product specific. And again, all of the prescribers and patients have to be educated on how to use the meds safely, about their risks, and how to store and dispose of them. The last medication that we're going to cover is Addyi. So Addyi has an REMS program. So Addyi carries the risk of severe low blood pressure, hypotension, and it can cause syncope, which is those fainting spells, because it actually has an interaction with alcohol being in any products. Like it could be in cooking wine, it could be in a medication that you're taking for a mild cough. So this REMS program is very important to stress that patients are being really cognizant about what they're ingesting and that it does not have alcohol. So all REMS participants must be trained and properly counseled by the pharmacy staff. All right, let's go ahead and take a break.